Welcome back to the Pregnancy to Parenting show. I'm so excited to continue this week with you guys, putting out 5 episodes this week, getting right to the point with some education and doing some awesome giveaways. So I'm really excited that you are listening or that you're watching on YouTube and that you are along for this ride with me. We are going to talk today about how to know when you are in labor and when to go to the hospital or birthing center. This isn't really necessarily for home birth because if you are planning on home birthing, you've probably already been in communication with your midwife and collaborating together on when the right time is for the midwife to come. You can actually really tell from a phone conversation. As a birth doula, I do that. I'll talk to clients on the phone, and you can kind of gauge where they're at by just listening through a contraction. And I've had that happen with my last couple of births too, calling the midwife. She's kind of listening through a contraction, seeing what I'm doing. And you can gauge a lot on that when it's time to come in. All hospitals and providers kind of like have their own thing that they're going to tell you. So they might be telling you 511, which means that you're going to go in when your contractions are 5 minutes apart, lasting a minute long for at least 1 hour. I'm going to give pros and cons of that a little bit of the typical information that they're giving you. Yes, pros and cons of it. But let's first just talk about how to know that you are in labor. So, of course, the Hollywood thing of my water just broke. Now I need to head to the hospital. And then their water breaks, contractions start right away. They head to the hospital and they birth their baby. That's not really how labor works for over 90% of people. So most women, their water doesn't break till later. So about 10% of births begin with your water breaking, which isn't ideal. It's nice that you're like, hey, I know that labor's coming now, because some of the other signs can be not so telling. Your water breaking is you're definitely going to be having this baby soon. Soon as in the next few days, not the next few hours, like TV likes to make it look. Not that that hasn't happened. Of course, that has happened, but usually not for a first time mom. So labor usually does follow shortly after, but not always. Sometimes contractions don't start right away. And I just want people listening to know that you have different options if your contractions don't start right away. So if you talk to your provider, they might be like, okay, well, come in a few hours, and we'll get you started on Pitocin. So basically, if your contractions haven't started, they're going to induce you at the hospital. But it's important that you know your options around that. Which is going to be like a whole different episode because we're going to just talk about when you know you're in labor and when to go to the hospital. But this does fall into that when to go to the hospital thing. If your water has broke, but labor has not begun, you have way more time than what providers are usually saying. There are risks to consider. So if you're a GBS positive, you are at a higher risk of infection happening the longer that you go. So, not saying that you have zero time, but you can talk to your provider about options if you're getting the antibiotics. The longer your water has been broken and you're GBS positive, the higher the risk of your baby potentially getting an infection as well. So those are things to take into consideration. However, some places you can go get antibiotics, then go home and continue to wait for labor. They might say you can't do that, but you can. You have options. You can talk to your provider and be like, listen, if my water hasn't started, I will come into the office, get a round of antibiotics, then go home and continue to wait for labor to start. If it hasn't started by X amount of time, then we'll talk about me coming in and getting induced. I just want to throw that out there because you have options. You're going to hear, no, you have to come in. They're going to start you on the antibiotics. Then you're going to be strapped down to a bed and waiting for your labor to start and then getting induced, and then you can't leave, and it can take days. You might feel much more comfortable laboring in your own environment, being at home, or just waiting for labor to start and being at home trying your own things to get labor to start, which there are a lot of different things that you can try. So I would just, again, take those things into consideration, especially if you are looking to have a non-medicalized birth. And that I highly recommend laboring at home as long as possible. When it comes to risk of infection, it increases after a certain point. But research shows that you can labor up to 3 to 4 days with your water broken without getting an infection, without the baby getting infection. But you do need to be monitoring for infection. So if your water is broken and you're staying at home and you're waiting for contractions to start on your own, um, make sure that you are checking for fever, that you're checking for color of your water and odor. If there's like a foul smell when your water breaks or at any point, because you're going to continue to leak water. That's another thing that a lot of people don't understand. They think that their water just breaks and then you're done, but your body continually produces amniotic fluid. So it's going to continue to produce fluid, and so you're going to continue to leak it. So if at any point there's a weird color, if there is a weird smell, also if you always have options. For me, if I saw meconium present in my fluid, which is the baby's first poop, so that means your baby took a poop while they were in utero, and that can put the baby at potential risks for a few things. Not always, the majority of the time, things are fine, but you may want to just have some monitoring, whether it's at the hospital or even if you're at a home birth or at a birthing center. Just the midwife with a Doppler can check in on the baby's heart rate, check in and see how baby's doing, make sure that maybe they didn't inhale the meconium or swallow it. Sometimes those things can cause some issues. But again, you always have options with these things. It's not just come in right away, we're going to strap you up and you can't leave. So you do have time. I'm not going to give out all of the research here. I have a couple of posts on it on Instagram, and I'll be sharing more this week on it. And eventually I'll make a separate video all about that because there's so much that goes into it. So your water breaking only happens about 10% of the time as a first sign of labor. So what are these other signs? You're going to hear a lot of weird words, right? Like mucus plug, bloody show. Your mucus plug starting to come out isn't necessarily a sign of labor. Your mucus plug can start to come out weeks before you go into labor, which is absolutely wild. It can grow back, which is rare. Like I don't know anybody that's actually happened to, like in my circle or in my clients, but I've heard of it happening. But your cervical mucus, or not your cervical mucus, sorry, your mucus plug will start to come out before you have the baby, in some cases, and in other cases it doesn't. With Jovi, I started to lose it a few days before I had her. And with Tula, same. I think that morning I started losing some. So it's like the day of. And then Carlo, like 4 days before I had him, I had like a streak of mucus. And then 2 days before him, I had a streak of mucus. And then the day that I actually had him, I didn't see any. And then there's also bloody show. So that's when you have blood that's coming out like with that mucus. That's your cervix dilating. It's everything happening. And that usually doesn't happen like too far in advance, but it can start to happen before you have labor, but that's not an indication of exactly when it's going to start. Having loose stools is a sign of labor, and that's one that's not going to happen like a week in advance. You're not going to have diarrhea and a week later have your baby. Loose stools are usually like you're going to be in labor soon. It's your body's own natural way of just kind of like emptying out, and hormone shifts and a bunch of things happening. With Jovi, I was already at the hospital kind of when it happened, and I went to the bathroom, and I remember I made Vito come with me, and then I like told my midwife and doula, I'm like, don't come in here because I'm not going to subject you to this. But I made Vito stay in there with me because I was in labor, so I needed help with the contractions. But I didn't want other people in there. But I definitely had loose stools while I was in the hospital with Jovi. With Tula, it happened in that morning. That morning while I was at home, I just kind of had some loose stools, and then later in the afternoon, we went to the birthing center and I had Tula. Um, with Carlo, a little bit of a different story, um, which we're going to share here soon. But I did with him, but also because I kind of forced myself to. So we'll get into that in another episode. But loose stools can definitely be a sign that labor is going to be happening. If you have IBS, then maybe not. I'm just laughing about that because if you listen to the podcast regularly, you know that I have gut issues. And for me, I'm like, loose stools, not a huge deal. It happens depending on what I ate. And so it may or may not be a sign of labor for you. Another thing that can happen is a backache. So some women experience back labor, and they've described the beginning of their labors just being a continual backache that they didn't even know that they were in labor, and it ended up being labor. I don't hear those stories either a ton, but it definitely happens. Most of the time, people feel contractions with it, and they have that backache with the contractions, not necessarily just a backache, but I'm pretty sure with my mom, with one of her kids, she just had a backache, and then had the baby not too far after that. So it can be a sign, but also you're at the end of your pregnancy and you're carrying extra weight in the front. So your back aching and hurting isn't unknown, isn't like a big thing. So don't be like, oh my gosh, my back aches extra tonight. Like maybe I'm in labor. It's a different feeling. So, the most common way that you're going to know that you are in labor is contractions. I know a lot of women start having a lot of Braxton Hicks toward the end. So, it's like, how do I know when I'm actually in labor? So, the contractions are going to continue to get closer together and continue to get stronger. And that is how you know that you are in labor. There's really no other way. When people are like, the Braxton Hicks, I thought I was in labor. Usually Braxton Hicks will simmer out, and especially with movement. So change up positions, change what you're doing, drink some water. I know I had a ton of Braxton Hicks like 2 weeks before I had Carlo, and I'm like, ooh, I might have him. And my midwife was like, are you staying hydrated? And I'm like, normally I'm really good about drinking water, but I remembered that day that we had a wedding and I was super, super busy trying to get ready. I didn't drink very much water. Then you're at a wedding and like, there's like limited water. I always feel bad, like flagging somebody down, trying to get more. But I was like contracting at this wedding all night. And I'm like, oh my gosh, like maybe this is going to be the start of the buildup toward labor. Um, and it didn't happen. And then a couple days later, I told my midwife about it. She's like, make sure you're staying hydrated. And it didn't happen again. I was drinking my electrolytes, staying hydrated, and the Braxton Hicks like that, as bad as they were then, like didn't really happen again. So hydration can play a huge, huge role, which you should be trying to stay as hydrated as you can toward the end anyways, or throughout your whole pregnancy. But I know it can be hard, especially when you have acid reflux and all these other things happening. And it's hard to keep it down, but definitely try to stay hydrated because it can cause those Braxton Hicks and it can even lead to preterm labor if you are that dehydrated. It can also, dehydration can cause loose stools. So there can be a little bit of confusion there. But when it actually is labor, your contractions are going to get stronger and closer together. If you are trying to have a non-medicated birth in a hospital, I would definitely labor at home as long as possible. I would say until I wouldn't go in until they are 4 minutes apart at the earliest. But there's so many factors that play into this. If it's your first, labors tend to last a lot longer. And the sooner you get to the hospital, the sooner interventions are going to be introduced to you. If you are planning on getting the epidural, then your plan's a little bit different. But I would still labor at home until you're thinking that you might want the epidural soon. Like, okay, like this is getting to a point where I'm going to need some pain relief soon. Then head in. Don't just head in right away because you're starting to have contractions. So that's like more for first time moms. For second time moms, it's a little bit different. Labor tends to happen a little bit faster, and you know your body. So if you've already been through it once, you kind of know what it feels like. Um, with my first, I went to the hospital way too early. And that is probably the most common for first time moms. Just going to the hospital way too early because you have no idea, right? Like your doctor's like, come in at 511 and you're like, okay, but you're laboring there for another 18 hours until things are like really moving. And then they're saying to you, oh, you're not progressing fast enough. We need to do Pitocin. We need to do this. We need to like do all these other things to make your labor move faster instead of just like letting your body do what it's naturally made to do. So I went to the hospital way too early with my first, and I'm a birth doula, and I'm educated, and I still went way too early. My water did break at home. I was GBS negative, and I had no signs of infection or anything like that. So I didn't labor at home very long. I was having contractions a little bit beforehand, and after my water broke, so my contractions woke me up. I got out of bed, made some tea, my water broke. Contractions picked up a little bit, but they still were very manageable. But we decided to head to the hospital because it's our first baby and we don't know what's happening. And you don't know what it feels like. So I'm like, maybe this is what labor feels like, and I'm already 6 centimeters. We get to the hospital and I'm 2 centimeters. And after we get to the hospital, I don't have Jovi for, let's see, I'm trying to, like 20 hours later, like 19 hours later. So we easily could have stayed home for a while. But you also have that adrenaline, right? That adrenaline comes in, you're really excited. You're like, oh my gosh, like we're gonna have a baby. And when I was like, hey, maybe I'm a 6, maybe labor is super manageable. Well, mine was not. I mean, I managed it pretty well, but I mean, that labor was extremely, extremely hard. And I dilated very, very slowly. So when I got there at like 2 in the morning, I was 2 centimeters dilated. And let's see, I'm trying to do math again in my head. 10 hours later, I was still 2 centimeters dilated. However, I had a cervical lip. So a lot of women end up having a cervical lip that's kind of preventing your cervix from stretching, which I would actually love to do an episode about this because you can have scar tissue in your cervix that is preventing you from dilating the way that you should, and can cause cervical lips, which there's different things you can do about as far as positioning in labor and helping the baby get into different positions to help balance out that cervix. So I had a cervical lip, and my cervix just wasn't moving. And so my midwife actually held it during a contraction. And during one contraction, I went from a 2 to 5 centimeters dilated. So this is why, again, I talk about like how birth isn't linear. Like what they're looking for at a hospital is for you to progress at a certain rate every few hours. That's not how everybody's body works. Like we're not robots. And that's based on Friedman's curve, which was this guy who came up with this curve forever ago, about how your body should dilate. But labor is not linear, okay? It doesn't happen on this linear path for every single person. Again, another episode, failure to progress and all of that. But so in one contraction, I went from 2 to 5 centimeters. And then 7 hours later, I was 7 centimeters. So it took me 7 hours to go from 5 centimeters to 7. So it was a very long labor. And I should have stayed at home like a little bit longer before heading in. Come to like my second one, I never had a cervical check. So I can't tell you where I was at in labor when I got there. However, the baby was born 3 hours later after I got to the birthing center. But if somebody were to tell me that at one point in labor, your contractions are gonna be 3 minutes apart, that never happened to me with Tula. With my second one, I was talking to my midwife. She's like, maybe you should head this way. And my contractions were like 7 minutes apart, but they were intense. And Vito was like, babe, these are so intense. They were between 5 and 8 minutes apart, but usually kind of around that 7 minute mark. And once we got there, my midwife said they never got closer than 4 minutes apart. So 4 minutes apart, that was normal for my second labor. Whereas my first labor, I was having contractions 3 minutes apart for 12 hours. Like just two completely different experiences. And again, with my third, I have no idea how far apart they were. I know we headed there when they were 4.5. I called her at 5 because they were getting really intense. And as soon as I hung up the phone with her, they went to 4.5. And like 20 minutes later, they were 4 minutes apart. And then after that, I stopped timing them because it was too intense and I couldn't be on my phone while I was in labor. And Vito was driving me. So to the birthing center, it was an hour drive because it was traffic hour. So the timing thing, yes, it can be a guideline. However, everybody's body is different. You could be contracting for 5 minutes apart for hours, for 24 hours. You can be 5 minutes apart. You could be 5 minutes, your contractions could be 5 minutes apart for 2 hours. You can be 5 minutes apart for like hardly any time, and then they speed up and then your baby's here. So the timing thing, I get it as a guideline, but also I think that there's so many other factors to look at as like how you're feeling, how intense they are. If you're planning on getting pain relief, what method of pain relief you're using. If you're using IV drugs, you can't get them past a certain point. The epidural you can get at any point unless you are pushing that baby out. So if you're like 10 centimeters, they're like, oh, you're 10 centimeters, you can't get an epidural. Yes, you can. You can get an epidural. 10 centimeters does not equal it's time to push. And you can get an epidural. Sometimes there's not an anesthesiologist available right when you want them. So that's another thing to consider. Again, a whole other episode about pain intervention and all the things you need to take into consideration. But again, if you're planning a non-medicalized birth, I would labor at home as long as possible. Keep in contact with your provider. If you have a doula, they are also a really good gauge on when to go to the hospital as well. I like to meet my clients at their home and labor with them at home. And then sometimes they're like, sometimes they're like, okay, we need to head in. Like, I want to get an epidural soon. Or sometimes they're laboring at home and I'm like, all right, I think it's time for us to go. So it is important to be educated. Another reason why I would say to, I know I've talked before about taking a childbirth education course is because you learn about all of this. So that's going to help you determine when to head to the hospital or birthing center is by taking a childbirth education course, learning about your body, learning about labor, and deciding, when that would be good for you. Because the more that you know, then the more you can make an educated decision on when to go. So, all of this to say, when it comes down to it, every single situation is different. I don't think that the 511 rule applies to everybody. With Carlo, they were 5 minutes apart and we headed in and he was born little over 2 hours after we got there. So, Jovi, they were 3 minutes apart for a day. So every single birth is very, very different. Not everybody falls into a strict pattern, and maybe that's a conversation to have with your provider. And then also taking into consideration your water breaking, if you're GBS positive, and your other options there. That's also a great question to ask your provider if you're trying to find if they're the right one for you. How do you feel about laboring at home after my water breaks? And if they're like, oh, well, at the 24-hour mark, we need to do a C-section. That's a huge red flag. No, you don't. If you're showing signs of infection and the baby is as well, then yeah, that's like a little bit different. There's other interventions to do. But if you're at home, you have no signs of infection and everything's good, there's no reason to do that, to just have a C-section at that 24-hour mark. Research does not support that. As always, I'll put some links in the show notes so that you can read more about it on your own. I hope that you enjoyed today's episode. I love talking about this stuff. Doing these short educational episodes are really, really fun for me. And let's see, what is the giveaway for today? Okay, if you are listening right now, because if you are listening past January 31st, 2024, I almost said the wrong year, 2024, you cannot enter into this drawing. But if you are listening in present time, I'm going to tell you what it is. It's the Spriggs Pregnancy Starter Kit. And I just want to read to you guys what all it is so that you know exactly what you're getting. Spriggs Life is an awesome company, helping women feel the best during their pregnancy and supporting that. The owners of it are absolutely amazing. And so I would love to gift you guys one of their pregnancy kits because they have a lot of great stuff in it. So they have their Mama Bear Pregnancy Tea that is a blend that has red raspberry leaf, ginger, which helps soothe, that has nettles in it, a lot of great stuff. They have their Mama Bear Prenatal, which is really, really great. I've been taking it actually recently. I go between taking I take the needed prenatal most of the time. Since I'm postpartum right now, I am taking some of the Spriggs one. And then it also has the belly balm in it, which is very soothing, and their magnesium complex. And the magnesium complex I actually take every single day. I get tired of taking like powdered forms of stuff. I would rather take pills. Some people prefer the powders. So you're going to get the tea, the balm, the prenatal, and the magnesium complex. It's a $120 value. So the winner of today's episode will get that. So you have to screenshot this episode and DM me or email it to me at elizabeth@elizabethjoy.co, and I will get your information and I will send this kit your way. All right, everybody. I hope that you are enjoying January. It is snowy here right now, which I absolutely love. And I'm excited to continue this week's episodes with you.